Hi, my name is Dr. Danie Pauw from Health 24, and I'm going to give you a few top symptoms to look out for. At 14 or 15, your health, you're in peak condition, and you often don't think about health issues, but there are a few symptoms that you should be careful for, and those are what I'm going to give to you. Number one, if you have poor concentration at school, if your marks are down, you're perhaps a little bit disorganized, leave the books at home and so forth, you should be careful that you might not have a learning disability such as ADHD, which is attention deficit hyperactivity disorder. And that really is something that can be treated quite nicely. It could also be that you have problems at school, bullying, problems with your fellow mates or teachers. Those should be addressed. Sometimes drug or sexual abuse can be a problem. And then sometimes having poor concentration could be due to some sort of a physical problem, such as epilepsy and so on. So if you have poor concentration at school, make sure you have it checked out. Top tip number 2 is a symptom to be careful for, and maybe this you'll see in a friend of yours, and that's any behavioral change that you might notice. Perhaps they've just become more socially withdrawn, they're not really social, hanging out any much, they might not be looking after their appearance that much, or have sleeping problems, sleeping too little or too much. And one should really be careful there for things like depression, perhaps also problems at school, again bullying and problems with teachers and so forth. And then very importantly, drug abuse, sexual abuse, those are things that sometimes manifest in the way that people behave. So if there any behavioral change in yourself, or you're going to notice that in a mate of yours, you better have it seen to. Top tip number 3 is a symptom to be also careful if in yourself or again with a mate, and that's a feeling of hopelessness. And that really one should be very careful for. Depression in children or teens is quite common, and that feeling of really life's not worth living for definitely has to be checked out. Top tip number 4 is a symptom, and we're going to talk more on the physical side of things now, and that's losing weight. Either in yourself or a mate of yours, there you should be careful of eating disorders. Anorexia, you've all heard about that, bulimia, that should be checked out. Or it could be something like underlying diabetes that you might not have known about. Diabetes can often in children and teens manifest or as being tired or losing weight. Other common symptoms of diabetes is drinking lots of water, peeing a lot, and also having an increased appetite. So diabetes is very common, and it certainly should be checked out. Top tip number 5 is a symptom, tiredness. Now all teens are tired, that we know, but if you are unduly tired every day, especially if you're a girl, you should be careful of a thing called iron deficiency anemia, which is really that you might be bleeding too much, and you actually get deficient in iron, which gives you anemia, and certainly tiredness is going to be the biggest symptom that you have there. So be careful for that. And also again, diabetes or any other physical disease can also manifest in being tired. Top tip number 6, symptoms specifically for the girls, and this is often missed. In fact, I had 3 sisters, and all 3 of them had a thing called scoliosis, which is curvature of the spine. So if your posture, if your one shoulder is a little bit lower than the other, or if you bend down and the back is slightly on the one side elevated to the other, that might be an indication of scoliosis, which is an abnormal curvature of the spine, and that should definitely be checked out. Much more common in adolescent girls than guys, and that if caught early, it could be dealt with quite nicely. Top tip number 7 is a symptom which I want you guys to look out for, and that's persistent headaches. Now we all get headaches, and that's cool, but if you have headaches every day and it really interferes with your lifestyle, that should be checked out. Headaches could be due to something like migraine or tension headaches or so, or especially if it's associated with vision problems, you can't quite see too well, that could be a sign of a brain problem, a brain tumor even, or so. And don't forget, teens also get high blood pressure. It's not completely, it's not only an adult disease. So if you have persistent headaches, you have to have your blood pressure checked. Top tip number 8 is a symptom that can be a problem if it's not dealt with, and that is recurring nosebleeds. Everybody gets nosebleeds, not a problem. But if you constantly have a bleed and it's without any known reason or any obvious reason, that could indicate some sort of a blood disease. Definitely has to be checked out. Top tip number 9, be careful if you always cough, if you have a chronic cough. Sure, everybody has cough and it could be a bit of bronchitis or cold, but if you have a chronic cough, it could actually be asthma underlying, so have that checked out. Top tip number 10, be careful of some sort of a discharge in the vaginal or the penile area. Be careful of any sores or any itchiness. Could be something quite simple like a thrush infection, Candida infection, which is a type of a fungus infection, or it could be because of a sexually transmitted disease. So that always has to be checked out. And those are it. You're going through a fantastic time of your life. I wish I was a teen again. But there are only a few symptoms you really should be careful of. And if you find any of these in yourself or your mates or anybody else, please have that seen to. Keep well. Cheers.